what's the first step the hormones do? Produce that plug. So what can you do at home to take that plug out or take away your blackheads and whiteheads to try and prevent the first process? Washing. Use a device called a Clarisonics brush. It is actually pretty incredible in the way this thing cleans your skin. It will give you the best improvement in your pores that you can see. When you're washing it, add a soap with a beta hydroxy acid, such as salicylic acid. Salicylic acid in low concentrations takes away your blackheads and your whiteheads. So have the right cleansing regime in all patients with acne. Then what can you do? Let's look at everything else you can do, what you see out there. Microdermabrasion will help smooth your skin, but not really help the acne a lot. Same with chemical peels. Facials feel great. Temporarily, your skin will look good, but it's not necessarily going to take your acne away. So the first thing your doctor will do is usually prescribe you the right cleansing regime, and topically they'll prescribe you with some prescriptions. So there's three main ingredients if you take a look at in prescriptions. The first is benzoyl peroxide, which is found in Dr. Khanna, as you know, Proactive. Proactive is a beautiful product for acne because it contains benzoyl peroxide. And what benzoyl peroxide does is do two things. It takes those plugs away and kills a little bit of the acne on your skin. One problem with it though, it is a strong bleaching agent. So if you're using and washing clothes after using benzoyl peroxide, you may get that tie-dye experience that you see. Often you'll use vitamin A, again it takes the plugs away. And usually we'll use topical antibiotics, and that will help kill the bacteria. In about 20% of patients, this is all that you'll need. It will basically take your acne away. That still leaves us with the other 80%.
So far we've got cleaning, because we got rid of the plugs. Now we've done some stuff on our skin to deal with the bacteria. So we've dealt with those two things. But you said the biggest cause was hormones.
Right.
So how are we addressing hormones?
Hormones are hard to address in males. In females, there's two ways we address hormones. First is birth control. Birth control, in certain situations, and in about 90% of patients, if you use the right birth control, it will essentially take your acne away. In about 80% of females. And there are certain birth controls you can use, and you really have to talk to your family doctor to see which will suit you. But in women that have not a childbearing potential, I'll often use a medication called Aldactone, also known as Spironolactone. This medication's been around since the 60s, and this is where everyone thinks I'm crazy. It actually is a high blood pressure medication that does little or nothing to your blood pressure. But it does one really amazing thing. It blocks testosterone from hitting your oil gland. And in women that are beyond their childbearing potential, using this within 4 to 5 months, you'll see about a 90 to 30% improvement in their acne with little or no side effects.
That was a big range, 90 to 30. So there are some patients who react... Sorry, just can you clarify that? Because it didn't make sense to me.
So most patients will see about 80 to 90% improvement in their acne.
Okay.
After about 3 to 4 months, though, it takes time to kick in. And what do we have in this world right now? Patience.
Well, right now we do. We normally don't. So what about the men then? So what do we do for the guys? Because we can't block their testosterone in puberty, especially.
Now this is a touchy subject we're going to get into. So in men and in women, which hormonal effects haven't helped in women, and in men, I'll often use a drug called Accutane. Now, this is again a place where you think I'm going to get crazy. Because when people come see me, they've already researched Accutane on the internet and they think I'm trying to kill them. But the fact is, this is an excellent drug, which is very, very safe. It's a drug that's never killed anybody and never done anything bad to people, with a very bad reputation. It's a drug that will give side effects to 100% of patients. You will get dry lips, dry eyes, dry skin. And that's going to happen in 100% of your patients. 10% may get aches and pains or a little bit of fatigue, but in reality, very little else, except for in women. In women, if you become pregnant on Accutane, it will cause birth defects. So we have to make sure women are on birth control. We're very careful for that, and they can get pregnant for 6 months after they finish their Accutane. But in 100% of patients, their acne will clear. And at ICLS, while you're on Accutane, I'll often give you skincare and do laser to give you that absolutely 100% clear skin that's beautiful.
How long when you said it takes months for the Aldactone? How long do you usually see an improvement with Accutane?
Actane's a funny drug. And 10 to 20% of patients may get it for. They start to lose confidence in me if they got worse acne in 2 months of being on a drug. And I go, hey, hold on, have confidence in me. Usually it's 6 to 8 months they're clear. So often you're on Accutane at 6 to 8 months. Sometimes you'll be on longer. There's a big controversy about the dose of Accutane. You should be on high dose, medium dose. I'm a low dose, low side effect, beautiful response. Just get it done slowly, get it done beautifully, get that perfect skin.
So stay safe, stay soapy, stay strong, and we're looking forward to seeing you all soon. And I hope this was helpful. And please feel free to join us anytime if you've got suggestions. As Dr. Z said, the Sisterhood of the Scalpel is here for you. There is no topic we will not touch. It does not have to be limited to what we do in our doors. Anything that can help, please let us know. And we really look forward to doing this again soon. And we miss you. Somebody said we miss you. We miss all of our patients. We miss coming to work, and we're looking forward to that. And the office is open between 8:30 and 4:30 if you do need to contact us. All right, take care, and thank you for putting up with our technical difficulties. I'm Dr. Julie Khanna, and this is the Sisterhood of the Scalpel. We'll talk to you soon.